There we go. As you know, every week we get these recorded. They should be on our portal for you as well. Thank you for joining us. We are in the first week of November. We still have 5 weeks to go for AEP, folks. So don't forget that. We are still in the early stages of AEP. I know we've been in it a couple of weeks or so now, but don't forget we are, as I mentioned, we still have 5 weeks left, pretty much up until last night. So there's plenty of time for us to continue doing what we're doing. And if things aren't working, let's change it up. So without further ado, let's get started. If this is your first time joining us, thank you so much. We do this every single Friday. For AEP, we do this at 8 a.m. and we'll be back at 9 a.m. come Friday, the 8th of December, in fact. So this week, we are going to go through a few of our updates. We're going to go through some more AEP tips. So again, we're going to be updating this every single week to give you some new tips and tricks, how you can really grow your business over the next 5 weeks. We've then got Judy Daniels here, who's going to go through her Judy's Corner. And she's going to talk about some of the things that she's seeing in the marketplace, some of the things she's hearing, and giving you guys a bit of an update from the Berwick perspective and her perspective as well. And then we're going to go through some carrier updates as well. So I would imagine today's going to be a little less than an hour. And we want to get you guys on your way here as well, so you can get out and about. Please put your questions in the Q&A. Obviously, utilize that chat box. I know you guys do. I love seeing the engagement there in the chat box and working together as a team. And that's what we're all about here, as you know. Okay, let's move on here. So updates for this week. I know some folks have been saying AEP started a little slower than they thought in some areas. I think there's so much disruption at the moment. What I've seen out there is there's a lot of leads, there's a lot of lead cards. And of course, it feels like some of these folks are taking a little bit of time to make their decisions. It feels like there's so much information out there this year, what they're hearing, what they're seeing, and some of these disruptions with some of the medical groups and carriers moving, leaving, changing plans. You put yourselves in some of these senior shoes. They're probably getting letters from the medical group. They're probably getting letters from the carrier. They're probably getting phone calls from the carrier. They're probably getting other marketing as well. So when we have opportunities to work alongside some of these medical groups and we're sending out different flyers and postcards and stuff, you can imagine that times X amount. And we're not the only ones doing it. So some of these seniors are a little confused. They're hearing a lot of different things and they're just taking their time. So I think, if you're in an area that's having disruption and you're not getting the traction that you want, or you're not getting the folks make their decisions, then, make sure you're a resource for them. Make sure they know that you can answer any question about any single carrier in that area. But more importantly, tell them, remind them you're local, the local market, and you're going to be there for them, not just now on the enrollment, but afterwards, the service side. And one line I used this week, I was at a meeting this week. I supported one of our team here at an educational event. We had about 20 people there. And one thing I said to them, I said, look, we are your advocates. We are here to help you and help you have a voice. So we can, work with the carrier partners, our medical group partners. We're there for you, not only today to give you the information and hopefully enroll you, but we are here to help you along your journey when you're on Medicare. So some of those things just utilize, and of course, if you're giving that message out to folks, they're going to start believing and trusting you, and they'll come back to you. What I would say as well on that is don't overcommit the last couple of weeks, particularly after Thanksgiving, because if you're overcommitting, you're giving yourself less time to write business. And I know I've spoken to some of you already about making sure you're available. Availability is one of the key things that you want to have, right? And the last couple of weeks of AEP, you want to be available, because if you're not available, they're going to write that business to somebody else. We know the costs are rising for Medicare. Wanted to leave this slide up. Don't forget Part B is going up to what, 174.70, I think it is. PDP premiums are going up. Yes, I've seen a huge influx of folks going on the WellCare prescription drug plan, which is, you know, less than $1. But we know that's not sustainable. We know that's going to change. And we know over the next 2 years that there is going to be disruption around prescription drug standalone plans and, generally speaking, prescription drugs. You know, there's some great plans out there, including Scan Health Plan that has got, you know, all of those expensive drugs on a tier 6. But again, you know, it's not just as easy as saying that, because it's not covered in the donut hole or the coverage gap. So for 2024, there's still going to be a risk of high costs. So you've got to do that analysis for all these folks, particularly around their drugs. We know in 2025 that there's going to be a maximum that anyone is going to pay on their prescription drugs, and that's, I think, it's going to be $2,000. So essentially, the donut hole is going to be pretty much going away then. So there's a lot of changes, but it's going to drive cost increases on the premiums, probably around the deductible as well, although the deductible normally is set through CMS. So the premiums where you're going to see the increase. We've got the 48-hour scope of appointment. I think that's making a difference as well. Don't forget, one of the exceptions you have is the last 4 days of AEP. You will not need to wait for the scope of appointment for 48 hours. That's important as well. So that 48-hour scope is only during this period, not the last 4 days of AEP. And don't forget, if you work at a kiosk or in informal sales events, anybody coming up to you, that's a walk-up. That's a virtual or a actual walk-in. And if somebody calls your phone you're not expecting, that is a virtual walk-in as well. So make sure you're aware of when you can and can't use that rule. Okay, some things that I need from you guys that are doing certain events. So I sent out an email last week. So if you're doing any of the Optum Archwell CenterWell sponsored events, then I do need your feedback using the shared forms that were sent to you. You don't need to email me the form back, because guess what? That form is actually on a Google Drive. So you can just put your information in there of your event, but I do need that feedback, because I have to feedback to the carriers and I have to that are involved. And that's obviously, I think, Aetna, Scan, and WellCare, but also the medical group. They're all financially investing into this. So their expectation is they're going to get this feedback. So Eve, I've given her the job of following you guys up. So please put your results on those forms. And then every week you're going to have an update, particularly at the educational events as well. We will next week as well be doing a call down just for all those folks on the Optum events that are coming up as well. So if you're involved in that, we're going to be doing a call probably Monday evening, Monday late afternoon. Okay. The other thing as well, I had a call with Optum this week. So if you are doing any type of Optum event in California, I do need your referrals that you are giving to Optum. This is going to help us for future opportunities. So I have to do my own report every single week for Optum. Well, actually, and basically, what we need to do is make sure any referrals you are giving out, and what I mean by that is anybody you're placing under Optum that's new to Optum, let me know. I don't need their name. I just need to know how many people you have referred to Optum. That's one of the things that, you know, we have to do with the partnership. And we're doing some Optum sponsored events. But if you are not doing those events, but you've referred 5, 6, 10 people to Optum, give me their names, please. Please let me know. Because guess what? That could open up a door. It could open up an opportunity. They want to know the agents that are focusing on referring them clients. And that's the same with other medical groups as well. You know, we've got relationships with a number of medical groups. You know, one of our agents in LA's very recently started working with Regal, and they're in the same boat. They want to work with all of you, but it's got to be a dual thing. It's got to be something that you are referring them clients, and they're going to then give you leads and opportunities to support them as well. So please feedback any of this news to me as well. Don't forget, you've got to request your marketing pieces from Claire. She's in our office there in Calabasas. It's not too late to do this second round of marketing. And, you know, if you're finding out that you're using some marketing pieces that may not be working, may not be getting traction, that type of thing, why not change it up? What does it cost you? It costs you nothing apart from a little bit of time. So maybe have a look through the AEP marketing catalog there. Get Joel and the team at Berwick. They can update that. And of course, use the tools and resources that we have to help you grow your business. Excuse me. Don't forget as well, the AMA agent portal now has the enrollment reporting tool. It's another ask of AMA that we're asking you. If you're doing any AMA sponsored events, please use this tool. There is now an online recording on how to do this. So there is an actual reporting tool 101. It's about a 15-minute call. So if you missed our Zoom the other week, then you have that opportunity to do this as well. Okay, let's have a little look here. We've got a few questions on here as well. And again, we'll go through those in a moment once I've done my updates. And AEP tips. So let's look at the AEP tips. So these are just some of the tips that I think are going to be important over the next week or so. And I'm going to update these every single week. And this is what I'm seeing in the marketplace. Make sure you refresh your marketing efforts in the second half of AEP. If you've been doing something and it's not working, don't forget, it's going to cost you nothing. Let's get some flyers in your local area. Ground, you know, grassroots marketing, boots on the ground marketing, whatever you want to call it, it doesn't matter. It's the same thing. It means you are going out and physically doing activity in your local area to help support and market yourself. So please, you know, if things aren't working, change it up, do something different, reach out to me. Reach out to my team. And of course, we can print that at no cost for you. If you want to collect it from our office, you get it even quicker. If not, it's going to take you about 5 days or so to get that through. Social media. So I've had some success this year doing some social media marketing. I think I showed you all that I was doing some marketing for our Medicare resource centers, right? So if you have a little look here, this is our little website. Again, we're marketing all these events. So we're doing some marketing around that. It's working. Social media can be a great cost-effective way to promote you and your business and activities. So even if you don't want to spend any marketing money on yourself, then you can post on social media, particularly Facebook, for no cost. Yeah, zero cost. It's going to cost you time. That's it. So if you're wondering what type of marketing you can do and have a very small or zero budget, then what a great way to do it. And guess what? It goes out to all your friends. Ask your friends to like and share it. And sharing it is very important. Get your friends to share your information, because guess what? That's like those little tentacles going out, because if your friends share it, then their friends see it. And if their friends see it, you've then suddenly got this whole network of people seeing your posts. You can even do some targeted paid advertising. They're called post boosts, where you can boost a post. And you can do this for as little as $20 a campaign. And each campaign, you set the length of time, could be a week, could be 5 days, could be a month. And then it asks you what your total budget is. And that's the total amount of money you're going to spend. And it tells you how many people it's going to target. So you could target folks over 65 in a particular zip code or city, particularly if you're doing events. So if you're at a Walmart, or if you're at a CVS, or you're at a kiosk or a camp, why not spend a little money on some targeted social media advertising? You know, if you think about it, one person turning up that you enroll is worth what? $300 to $375, depending where you live. You could even do $50, $100 of marketing on social media. That's probably going to get you that one person, and you've already made a 300% return on your investment. So think about how you can stand out from the crowd. Think about how you can do things a little differently. Maybe trial a little post boost for $20. It's not going to really cost you that much. The other part is be present in AEP. Be where you need to be. If you don't have activity, go and find activity. Ask me, ask Berwick, go out and ask the carriers. There's activity out there. We've got call blitzes. Last week, we had 3 different call blitzes. 2 of them I advertised on here. And again, these are opportunities that we are going to have going forward as well. So we are really excited about the opportunities out there. There are opportunities to get in front of seniors. Our job is to get in front of folks that need our help. And if you're at a kiosk and you're saying there's no activity, what I would challenge back to you is, so you're telling me not any seniors are walking in that store every day? Because if they are, what are you doing to excite them and bring them over? One of my agents this week told me that they're playing music and really making their kiosk inviting for people to come up. Have some candy. You can buy candy after Halloween at virtually nothing. Have something at your table that's going to bring somebody over, or at least engage them. The other thing is, if you're sat behind that desk on your phone, you will never be successful at a kiosk. You need to, yeah, I get it. Your feet are hurting. You want to sit down, that's fine. But get up, stand in front of your kiosk, talk to people. As long as you are not talking about Medicare and saying, hey, come and look at our Medicare table. You can talk about anything, but engaging those folks is the important part of this. If you're at a kiosk at a doctor's office, exactly the same thing. Talk to them. Good morning. Hi, how are you? What a beautiful day. Look at the weather at the moment in California. It's amazing. It's 90 degrees. If that's not a great starting point, then I don't know what is. What a beautiful day it is today. Hope you're well. Happy November, anything. But you've got to be out there engaging people. Otherwise, you really are not going to make the most of that kiosk. Think of your time. You're not getting paid an hourly rate. But if you're at a kiosk for 3 hours and you get 3 leads, that possibly could be a $1,000 investment. So make sure you're out there, make sure you're noteworthy, make sure you're presentable, you've got some excitement. Because with kiosks, it's a lot of it is about how you interact. So if you think it's not going to work and you're telling me it's not going to work, you're right. If you email me and say the kiosks don't work, you're right. Because if your mindset is that, it's not. If you email me and say, Neil, I love my kiosk, I'm trying to do everything I can, I love being here, I know it's going to work, you're absolutely right. And my other thing is, I think, I've told this story before. One of our most successful agents, he's got over 500 clients in his book of business. He still does a kiosk every single Monday morning. He does a CVS because he believes in it. Clients know him. If he's not there, they ask for him. And that's all about consistency and being there every week, all year. So please don't think, okay, I'm too experienced to do a kiosk. I don't need to do a kiosk. It should be part of your plan, folks. I'm a huge believer in them. Okay. Anyway, I'm going to get down on my soapbox there, but you can see the passion and I believe in it. So that's why I want to kind of talk to you about that as well. So be present with your activity. Try and get that activity. You've only got 5 weeks left, guys. Then you can take a breather and, sit at home and relax and do what you need to do. But these next 5 weeks is going to be critical. Work with some of those regional carriers. And I mentioned this last week, or new to the area carriers, offer your help. Be an advocate. I had a meeting this week with United Healthcare, one of their VPs. And that meeting was really talking about, agents and brokers. And, the scenario is we are the advocates for the carriers. The health plans, yeah, they do their national marketing. They do their stuff. That's it. They can do no more. Those carrier reps are relying on you. They're relying on me. They're relying on us as a team to deliver and help them sell their plans. And guess what? We all win. So how can you help them? Talk to them. Say, hey, do you need any help? I'm here for you. One of our agents has done something pretty unique this year. They're kind of a pinch hitter. So those of you from a baseball term, a pinch hitter is somebody that comes in when maybe the team's not winning to go out there and try and win. That's what their job is. Well, guess what? One of our agents is doing that. He's that pinch hitter. So he's saying, look, if things aren't working or somebody calls in sick or you need help, call me. I can be there at the drop of a hat. What a great idea. Just doing something different, thinking outside the box. Look for local disruption. You know, I'm talking to Terry and her team in San Diego. I know they're crazy busy. And, you know, they are back to back with appointments. That's disruption. We've got disruption in other markets and he's not as busy. So find a way to become a resource in your community. Think of the difference that you can make wherever you are. Maybe there's a new plan. So if you think where you live and where you work, what's happening this year that's different? Is there a new plan? Is somebody leaving? Is there a medical group new? Is somebody leaving a medical group? There must be something. Think of that difference, think of the questions, and then go and react to that or be proactive to that and go and find some activity. So these are just some AEP tips that I'm seeing out there. I'm finding that's working. Look at your own marketing, be present, work with your carriers and find local disruption. If you do that, for sure, you are going to make enrollments this AEP. And if you're not doing that, you're probably a little bit one of those folks that's still waiting for things to happen. And it's not going to happen if you wait. You've got to go out there and make it happen, folks. So that's my tips this week. Go out there, make a difference. You've got 5 weeks left. 5 weeks. What's that? Like 35 days or something. So lots of opportunities still here to go out and make a difference over the next 5 weeks. Okay, so that is it on AEP tips. I'm now going to bring in our expert from Berwick Insurance Group. Many of you have been seeing Judy up and down the state of California this AEP. She must be needing that coffee that we see on her picture here this morning. Judy, if you don't mind, I'm going to run through some of these questions with you so we can answer them between us. And good morning.
Good morning, and you've got that right. I've got my coffee, and I have been up and down the state. Calling in today from Fresno, was in San Jose last night for a few hours, which is only a 2.5 hour drive.
Wow, wow, wow. Amazing. Okay, so Judy, I'm going to run through some questions. If you want to jump in and help answer, great as well. Let's go through this. Thanks for your questions here. So if a dual eligible Medicare beneficiary enrolls in a Medicare Advantage PPO plan, what happens? Can a member in a PPO plan use out-of-network benefits to see Scripps advisors? Well, there's two different things here as well, I think, Judy, because there are some PPO D-SNP plans and there's some regular PPO plans, right? So depending what one you mean, I would imagine you mean a regular MAPD PPO plan here. So Judy, have you got any advice on this?
Yeah, so the key thing here is if they are dual eligible, even if they're going to have a regular PPO plan, they still have to make sure that they're seeing doctors that are also contracted with Medi-Cal or Medicaid. Medicaid, of course, in all the other states, Medi-Cal here in California. So keep in mind that if you have a PPO plan, you're dual eligible, and you see a doctor that is not contracted with Medi-Cal, that person does have to pay that copay out of their pocket. So they do need to make sure that they're seeing a doctor that's contracted with Medi-Cal so that they can bill Medi-Cal for that extra amount. Now, the other part of that question is, what if you see somebody who's out of network? So if you see a doctor, and I think that was in regards to Scripps, if I'm not mistaken. If you see a doctor like at Scripps, for example, that is not contracted with a PPO plan or with in this case, yeah, I'm so sorry. I was just thinking of something else. But if you are seeing a Scripps doctor, for example, they're not contracted with the PPO. Can you see them as out of network? You can, however, any doctor that's not contracted with a PPO plan and you go to see them, it is not guaranteed that they will bill the insurance company. So you may have to pay out of your pocket 100%, and then you do the paperwork with a claim to that insurance carrier. Keep in mind also that that doctor or facility has to also have a Medicare contract. If they are not Medicare contracted, then all cards are off the table.
Thanks, Judy. Next question as
Oh,
well.
and by the way, they can still refuse to see you too. That is also something you have to keep in mind.
Thanks, Judy. Okay, next question. I'll jump into this one. Clarification on another Medi-Cal question. And this is Medicaid, Medi-Cal. Medi-Cal is Medicaid in California. For those of you that aren't in California, if a dual eligible member enrolls in a regular MAPD plan, how does the member's Medi-Cal work? Well, pretty much, as you know, if you're on Medi-Cal or Medicaid, you can enroll in a regular MAPD plan. The reason there are certain D-SNP plans, twofold. One, generally speaking, if you look at the copays on a D-SNP plan, you'll see 20%, right? So what happens is that carrier will actually bill the 20% to Medi-Cal to pay that amount. That then gives that carrier more money to put into the extra benefits. So generally speaking, somebody on a D-SNP, they'll get those extra benefits, things like the food card and stuff like that, right? If you put them on a regular MA plan, absolutely, the client can go on that. They may not have as rich benefits for those extra benefits. And as long as that doctor is in network and accepts Medi-Cal as well as Medicare, then they can see that doctor. So that's the important thing here as well. If it's a regular MA plan, they've got to make sure that doctor accepts both Medicaid or Medi-Cal and Medicare. Obviously, if it's a D-SNP plan, we already know on that D-SNP plan, those doctors in that network are going to accept both Medicaid and Medicare. But you need to check that that doctor does accept Medicaid or Medi-Cal as well as Medicare on a regular MA plan. And of course, they're not going to pay those copays on that regular MA plan because it's still going to get billed to Medi-Cal or Medicaid. That's how that will work. That's the difference between the two. But you'll see the differences in the amounts because a lot of the amounts are zero. So obviously there's nothing to bill Medicaid for some of that or Medi-Cal. But again, on the D-SNP plans, that's when, generally speaking, that carrier is going to bill Medicaid a little bit more and they can offer those additional benefits. But it's all about making sure those doctors accept both. Next question is, somebody calls for assistance. Did I say I do not have to wait 48 hours? Correct. If you're not expecting a call, it's like a virtual walk-in. So imagine you're in your office, somebody walks in and says, hi, I need help with my Medicare. Can I enroll in this plan? Yes, you can. If somebody calls you and says, hi there, I got your name from somebody and I wanted to call you, I want to enroll in a plan. That's a virtual walk-in. So absolutely, you do not need to wait the 48 hours. That is correct. Okay, same question. Let's have a look on here. I got a lead from Planenroll who says he's enthusiastic about getting a plan, but for whatever reason, he will not sign the scope of appointment. Any suggestions, Judy?
Well, I'll tell you, and by the way, she said, actually, never mind. He just signed it this minute in a comment further down. But I just for edification here, I will tell you that you can use the age-old thing, blame it on somebody else, and simply say, the federal government, the Center for Medicare and Medicaid Services, is requiring that we show that we had permission to talk to you about benefits. So without this signature, I wouldn't be able to talk about benefits with you.
Perfect. The other way you can do it as well, particularly on Planenroll, is everybody has, whether they've even done the Planenroll network agent training or not, you all have your own client-facing website, right? It's a Planenroll website. It's a URL. If you send that to a client and they go on your website, they can enroll themselves without the need of a scope, but you cannot help them. That's the other way you can do it. Okay, and that would be allowed as well. So they go through your personal URL. You've probably heard it called a PURL, or your personal website, and that can be done as well. Okay. Weather-related SEP, I think we covered it last week. In some counties in California, we have an extension, I believe, on both WellCare and United Healthcare. That's the only carriers, I believe, that are doing that. Judy, anything I've missed there?
Scan does as well.
Scan does as well. So it's still continuing. Obviously, though, at the moment, you're only going to enroll them for 1 month on another plan. So, this is the time really, if somebody's making a change, what you don't want to do, and just to give you a tip on this, you don't want to be enrolling somebody for 1 month on one plan and then moving them to another plan. So think about the plan they're going to stay on and try and either wait for January 1st or put them on the same plan that's going to roll over next year. You don't want to be riding two pieces of business this time of year. Okay, what is the difference between home support and home healthcare?
May I take that one?
Sure.
Okay. So, in-home support services is something that is covered by Medicaid or Medi-Cal. And that is for somebody who's dual, who needs additional support, such as, um, bathing, cooking, cleaning, uh, toileting, etc. There's domestic services, and then there's medical needed services that in-home support can do. And those hours that are allotted are done through an evaluation by the county health department. For the home health services, that's when you have a RN, a registered nurse, or a home health person come in to do IV fluids or to do injections, or in the case of a medical stuff, it could even be where somebody needs wound care. So that is something that is covered by the Medicare Advantage plans as well as Medicare, the home health services. This is not custodial care. Just remember, custodial care is not covered by Medicare or by Medicare plans.
Okay. So next question here. Person started receiving Medicare on October 1st based on disability. She wants to start a Medicare supplement on 1/1/24. Will she have a guaranteed issue based on Part B open enrollment? Yes, she will, but be careful with this because she's likely to be under 65. So really, Medicare supplements are not designed for those folks under 65. And the reason we know that is, look at the cost. And there's very few carriers now that offer Medicare supplement under 65. So be careful if somebody's receiving Social Security disability and they want to go on a Medicare supplement, I would have that conversation with them about, right, why don't you try a PPO to start with? Because if you look, I know, for example, Blue Shield, who offer Medicare supplement under 65, is about $1,000 a month. United Healthcare, by the way, you have to be over 50 or you can't even go on a Medicare supplement. So it's really important to note and just talk about the cost of a Medicare supplement. The reality is it's not designed for somebody under 65. The reason why is if they're on Medicare before the age of 65, they're not well. So obviously that drives the cost of Medicare supplements up if folks are on there before 65. So the reality is I would try and say to them, look, you're going to pay a lot more out of pocket for your Medicare supplement before you turn 65. I've got a great PPO plan. That might be an option. Anything to add on that, Judy?
Yes, actually. When the person's under 65 and they get Medicare due to disability, they do have a guarantee issue for that first 6 months that they have their Medicare Part B. So in your particular case, Mila, that would be true. Keep in mind that, just as Neil said, there would be higher costs because they do know that the person is sick already. But if they do not make a choice in that first 6 months, they would be locked out from having a Medicare supplement until they turn 65. So I would highly suggest that you take a look at their age. If they're under 50, it's not going to be United Healthcare's AARP Medicare supplement. The next least expensive would be Health Net's under 65 rates for Medicare supplement. But again, you're limited to the plans that are offered for people under 65.
Okay, thanks, Judy. Another question just on the PPO plan. I'll take this one. Have a few Medicare supplement potential customers interested in PPO plans. Any company PPO plans that you can recommend they can use outside of California at a national level? Well, you want to make sure it's not an LPPO. Quite rightly, you wrote on their alignment is great, but they only have that local network. Absolutely. You're talking probably about LA County or there's counties around that. United's probably your best option. They have a great PPO, and of course, they can use those in-network hospitals and medical groups that are pretty famous throughout the United States, like Cedars-Sinai, UCLA, City of Hope, those type of places. So absolutely, I would say United. Aetna's worth looking at as well. They have a decent national network. So I think they're probably your top two. And Humana has a good PPO. What I would say with Humana's PPO is they do have a national network, but check, they don't have all of those medical groups that I mentioned in their network. And I know they were asking particularly about Providence and Optum, and neither of those are in network with the Humana plan as well. So you want to check where they're going to go, but probably United's got the most providers. I think they've got 1.1 million. So that would be my answer. Going back to the scope of appointment question, what if you left a voicemail for somebody and they call you back? Yes, it does apply the rule because you initiated the contact. If you initiated that contact, then you have to wait the 48 hours. Absolutely. Okay, clarification. Is a scope of appointment needed if you're just sending a quote and the client then goes into the quote and enrolls themselves? Judy, do you want to take this one?
Yeah, in general, you're supposed to try to get a scope of appointment. Send that along with the Medicare
Quote.
app quote. Yeah, in general, but you don't have to. But in general, I would try to, just in case they have some follow-up questions while they're doing the application.
That's a really good point there, I think, as well, because if you talk, you can't talk about benefits. That's the key thing. A scope of appointment is all about you talking about benefits or plans or anything. So if you're sending something and they're not needing you to do anything, but as Judy says, if you've got a question, they have a question, you can't answer it without a scope. So that's a really good point to make there and a great answer. Thank you. For us green agents, and I think we're saying new agents, would you consider doing a webinar on the whole issue of Medi-Cal and D-SNPs, etc.? Well, can I answer that one, Judy? Because I have just done a brand new 52-minute webinar on how Medi-Cal works and Medicaid. So it's on our agent portal already. It's recorded. We have a ton of recordings for new agents. So I just want to bring that up. We have a new agent webinar. We have a Medicare 101. We have a marketing 101, and we have a selling 101, brand new 2023 trainings that are available for you at a snip of a button. We also have Medi-Cal, Medicaid selling, and how to offer dual eligible plans. They're all available on the AMA agent portal. Also, Berwick has a lot of this training on their portal as well. So you've got a ton of stuff you can actually go and look at yourselves. Okay, lots of questions today, Judy.
I know.
Very few carriers pay commissions on under 65 Medicare supplements. United Healthcare has the lowest premium in LA County for under 65 med supps, but as Neil said, the prospect must be 50 over. United Healthcare does pay commissions on under 65 Medicare supplement policies. So I think that's more of a comment than a question. It's quite right. Some of the med sub carriers are starting to not pay unless it's somebody new to Medicare. So as Scott said, under 65, some supplements don't pay, but also some birthday rule carriers don't pay as well. So be careful if you're writing supplement. My answer is write MA, guys, write MAPD. You've got PPOs out there. You've got lots of great choices, particularly now with the increase in the price of prescription drug plans. Yes, forget WellCare. It's an outlier. Trust me, it will not be at zero cost next year, those PDPs. Trust me. They're not, and if they are, you will not be getting paid. So just to let you know, over the next 2 years, you are going to see people trying PPO plans rather than Medicare supplements, because not only the cost of the supplement, but the cost of the standalone prescription drug plan. Please bear that in mind. Drugs to qualify under the 2025-2000 drug MOOP, drugs must be in the formulary. Absolutely. That's the same with any plan. If it's not in the formulary, it's not covered. You're going to pay full price. Absolutely correct. Can a person who is on a supplement switch to an MAPD and wants to go back to the supplement after their birthday? Okay, well, the birthday rule has nothing to do with whether the person can go back on the supplement, but they may qualify for a one-off opportunity where they can make a switch. If somebody has never been on a Medicare Advantage plan, they have an MA trial period where they can go on that trial period through an MA plan once in a lifetime. So if they've ever been on an MA, they can't do it. But there is a trial period for somebody on a supplement that wants to move to a Medicare Advantage plan. And that can be either a PPO or a HMO. That trial period is up to a year, and they can go back to their same supplement, guaranteed issue. Hopefully that answers the question. It's nothing to do with the birthday rule. I think you're getting confused with two different things. Okay, and then final question. Is Prolia covered by Part B? What would be the copay?
May I take this one?
Sure.
So Prolia is an injectable. In general, Part D, as in drug, is what covers the medication if you get it from the actual pharmacy yourself or from a mail order pharmacy. But Part B, as in boy, is what covers the medication if you are acquiring that medication through the doctor's office and the doctor's office actually gives you that shot or that IV. So in this case, Prolia would be, as long as the doctor agrees to furnish the medication and give the medication in their office. If they're on a Medicare Advantage plan, most of the Medicare Advantage plans have a 20% coinsurance for Medicare Part B drugs. In these cases, sometimes it is good to get them on a Medicare supplement if they can qualify for it, because most of the Medicare supplements cover Medicare Part B drugs at a zero copay, of course. So, and that depends on the letter of the alphabet that plan is.
Thanks, Judy. And the other thing as well, that's when the MOOP will come into play. So like Scan Classic, that has a $199 MOOP, which is part of Part B, right? That would be helpful as well in this case.
Bingo. Yes, indeed.
Wonderful. Okay, so that's all the questions. Judy, what have you been seeing out and about this week? What are any updates that you have?
Yeah, so first of all, for those of you in Northern California, Wellbe Health PACE had a new center open in San Jose. They had an agent event last night for tours and to, talk more about the center. It's a beautiful center on Hamilton Street there in downtown San Jose. Patients will be seen and it'll be open to members of the PACE program for Wellbe Health PACE starting January 1st. However, agents can start doing the intake forms now because it takes 30 to 45 days for the overall approvals to get done. So highly encourage you if you've got clients in Northern California, in the San Jose area, definitely check out Wellbe Health PACE as an option for somebody, especially those who only have Medicare Part B. I also want to talk about the areas that have plan terminations. Essence comes to mind in Northern California. Scripps comes to mind in Southern California and San Diego. Remember that Medicare supplements do have a guaranteed issue in the situations where a plan is terminating. So you do have a guarantee issue available to you for a Medicare supplement. If there is no PPO plan available in an area, that is an option to look at as well. Now, another thing that I'm hearing out there and seeing is that dental seems to be very important to folks this year. So don't forget, first of all, you do have National Care Dental available to offer. You can get contracted by sending that request to Lisa Perry and at AMA, coveredama.com, and she will send that out to you. Another thing to keep in mind is that each different Medicare Advantage plan, whether it's an HMO or PPO, has its own dental network that they use. WellCare and Scan Health Plan use Delta Dental. But if it's an HMO, remember that Delta Dental has a variety of different plans out there. So for an HMO, it's going to be the Delta Dental Care USA. Also keep in mind that there may be some dentists that even though they show a network for Delta Dental Care USA, it may not include the Medicare plan. So always follow up with that dentist as well. Now, I've had recently the opportunity to sit down with some agents that were at some meetings, and believe it or not, some of the prospects were making decisions based on the dental plan and the dental coverage that each of these plans had. So it is something to be familiar with and how they work. If it's a dental PPO, make sure that you're letting them know how that works for that plan. But you got to be knowledgeable. And if you're not so sure, reach out to that agent manager for that carrier. I also wanted to reiterate that, and Neil covered this in the tips, but if something isn't working, change it. You still have time, change it and try something else. And if something is working, hey, keep right at it. Keep using that. I also wanted to briefly share an experience with one of our Berwick's most uh, prolific writer of Medicare supplements in Los Angeles. It's a gentleman that's in the Bel Air area, and I'll tell you, he is writing a lot of Medicare PPOs, United Healthcare PPOs in particular. His comment was this, and this is absolutely true, you guys, and you got to think about this. As people are aging, their Medicare supplement premiums have gone sky high. And in his opinion, and he's looked at all of these things with these extras and so on, there is no reason for somebody in Los Angeles County to have a Medicare supplement if there's a United Healthcare Medicare PPO, Medicare Advantage PPO available, because you've got that zero premium or low premium. You've got everything covered. You have the ability to go to UCLA. You have the ability to go to Cedars-Sinai. You have the national network. Why wouldn't you want to have a Medicare Advantage PPO and pocket all of that money that you're paying for Medicare supplement and a Part D plan? So I wanted to share those experiences as I've gone around and talked with folks, and let you all know that this is the real stuff happening out there, and keep up the good work.
Okay. Thanks, Judy. A few more questions here while you're on. Let's go through these. If a client only has Medicare Part B and they have to pay for Part A because they haven't worked enough, is it possible for them to enroll into Medicare Advantage plans?
Absolutely. Absolutely, because they do have Part A. So they have A and B. You can enroll them into a Medicare Advantage.
But this client only has Part B at the moment, so they would have to apply for Part A and pay for
Oh,
Part
I'm
A
so sorry.
before.
I thought when it said they had to pay for Part A, I thought it meant that they got Part A and they're paying for it. I'm so sorry. Yes. So in this case, they don't have Part A yet. They're having to pay for it. So what you want to do is help them to apply for the Medicare Savings Program if they will qualify for it, and apply for their Part A contingent on qualifying for the QMB status under the Medicare Savings Program. If they do not qualify, then of course they would have to pay for Part A, and then they can get their Medicare Advantage plan.
Okey-doke. And that's been quite that's a usual type thing that comes up where folks have moved here later in life, maybe to be with their sons and daughters, and they qualify for Medicare because they've been here for 5 years as a permanent resident or they're a citizen. However, if they've not worked here, then that's quite often where they say, oh, you don't qualify for Part A. Well, you do, because the qualification for Part A and B is the same. The main difference is they don't qualify for free Part A. So that's where folks get confused, and that's sometimes where that communication that comes from Social Security is different. But as Judy mentioned, if they qualify under the Medicare Savings Program for QMB status, they would actually pay for their Part A. So that's something to bear in mind as well. Another question here. I've heard there's a new PACE center opening in Sonoma County. Absolutely, there's these all year, there's many companies now that offer PACE. Don't forget, generally PACE was only offered where agents were not allowed to sell or offer PACE programs. WellBe Health is the one that we can offer. So there may be another PACE program that's not WellBe Health that obviously you can't get involved with, and that happens all the time, but WellBe Health is the one that agents can offer a PACE program for. Okay, last question here, and then we're going to move on to some of the carrier updates. If a person comes from Kaiser or SCAN to a Medicare supplement, is there a guaranteed issue?
Well, no, in general, there's not a guarantee issue when you're coming from a Medicare Advantage plan to a Medicare supplement. The only time that it would be a guarantee issue is if there was a 15% increase in either a premium or in the services for that Medicare Advantage plan. And at that point, you would have to also include the ENOC, the Annual Notice of Change document that is showing that, along with the Medicare supplement application to show that there's that guarantee issue.
Thank you so much. Okay, Judy. So we're going to move on to the carrier bits. And again, any questions come up, we'll jump on them as the next 10 minutes or so goes, but time is moving on here. So not as many updates this week. There are a couple of open houses. So P3 has a brand new clinic on Nellis. There is an event here, an open house on Wednesday next week. So that is 8 a.m. to 10 a.m. Then also P3 has their new SMS list. So sign up for their broker text messages and stay in the loop. So if you want to receive text messages from P3, then you can sign up and stay in the loop. WellCare are doing a ton of trainings. This is a great opportunity to talk about leads. So if you are looking for opportunities in Nevada, then please jump onto these calls. WellCare may provide you leads. They'll talk about leads. In fact, one of our agents has been given access here to the Salesforce account by going onto these every single week and engaging with WellCare. So congrats to you. And this is a great opportunity. WellCare Wednesdays as well is continuing in Nevada. So again, tons of training, as you can see, Ascend, Benefits Deep Dive, Workbench, 30, 60, 90-day book retention as well. Let's look in California updates. Great news in California and Colorado. Members who are enrolled in supplement insurance can now take advantage of a new no-cost one-year program aimed at improving mental wellness. So Able To is the name of the program. And as you can read on here, it provides opportunities for clients to register on demand, and they can choose from a variety of mental health skills and tools. It's like one of those apps you get that you pay for, but it's a free opportunity for members to do that as well. It's voluntary. And members will be communicated with that as well. Sorry, I zoomed through that a little quick. Anthem Blue Cross or Anthem here in California are offering a bonus for their supplements. It's been extended through July 1st, 2024. So open enrollment bonus is $200 and the underwritten policies are $150. Also in Northern California, Anthem are doing a halftime huddle. So nice opportunity here at El Torito. Go and get some sales kits, win some prizes. And yeah, they're probably going to offer a little bit of snacks and happy hour by the looks of it. So this will be next week, 3 till 5 p.m. in Milpitas, which is up there in Northern California. Great opportunity for you to stop by and see Tony up there and get some kits and some prizes. Brand new day, Central Health doing a ton of Microsoft Teams training, as you can see, throughout the whole of November. Look at the dates there. You should have received this if you are in those areas. UCLA Health is in network for members in Pacific Central Coast on all of their PPO plans. So just to let you know, these are the PPO plans that range right up from San Luis Obispo County, right through Santa Barbara County into Ventura County and into Kern County. And what we mean by that is that you can see any UCLA provider in network. WellBe Health, we mentioned it earlier. Well, this Saturday, tomorrow at 10 a.m., there is an open house in the North Hollywood location on Victory. Please RSVP to an email or text broker or call broker support here as well. And again, this is an open house where you can bring somebody with you as well. WellCare, we said about their training. Wow, they're going for it. Look at this in California. Tons of training. You can see it's by date. They are doing training every single day. So those of you that are not out in the marketplace or don't have, that kind of activity that you should have, these are some good things that you can jump on and learn about. I'm not going to go through everything. Take a screenshot, copy it, whatever you want to do. This is WellCare's training. And then, as you know, Alignment are offering those HRAs. Pretty much, I think now every carrier is offering an HRA or VBE. It's the same thing if you hear both of those. Apart from Blue Shield of California is the only one I believe that doesn't offer it. Also, Berwick's listed out. They are looking for plan enroll campaigns. So there are tons of plan enroll campaigns going on. Please connect. This helps consumers connect with agents. If you've signed up as a plan enroll agent, you might be receiving leads for free as well, particularly if you are participating in campaigns and buying some, you might get some for free. I've seen that happening. So if, again, you're looking for something new and someone new to partner with, the Plan Enroll exclusive lead program will help you get some leads. Yes, you might have to invest, but guess what? We will co-op anything you sell. So again, AMA will pay and co-op for leads that you sell through the Plan Enroll. Great opportunity here as well. This is through Integrity's Medicare Center. Cigna, as you know, are now paying commissions on standalone prescription drug plans. They're also out there in Nevada, in Clark County. So great opportunity for you folks in who offer some med sups or in particular have a lot of clients with PDP plans and also out there in Nevada as well. Humana is offering some bonuses in certain states for their med sups as well. As you can see, California is in there. Unfortunately, Nevada is not. And again, this is $325 for an underwritten policy and $150 for the open enrollment policy. That's for the first 6 months. They are eligible. Medicare Center, lots of great stuff on here. This is the new things that are available. Mobile app, quote, enroll and train, call recording, scope of appointment tracking, personal agent website, Silver Sneakers real-time data leads, benefits becoming a plan agent, CSG app training, lots of different things happening on the Medicare Center. Please look out. They do have their very own, Integrity has their very own Medicare Center go-to webinar kind of portal where you can look at lots of trainings as well. WellCare, don't forget star ratings. You've got to put those star ratings, talk about those 2024 star ratings. That's the same with every single carrier. Special consideration around DSNP PPOs. We just mentioned that as well. Before enrolling somebody in a DSNP PPO, you need to verify their chosen provider accepts Medicaid. We just went through that as well. And then WellCare has a brand new application tracker for members and brokers offering real-time visibility on application status. It's enhanced this year. It's called an application tracker. It's online in your portal. Paperless member communications, that's a more effective and convenient experience for their members as well. That's nationwide. They are communicating paperless. And that is it from me. Couple of questions here. We're at 9 o'clock here. If a potential has Medicare Plan G and they want you to change them to an N, will you be the agent of record? Well, they can only change to a Plan N using the birthday rule. So as long as you change them using that carrier that pays commissions, then you will become their agent. But make sure they understand that changing to a Plan N is going to provide them with out-of-pocket costs that they won't have with Plan G. So, you know, I would definitely look at that Plan N, but I would also compare it to a PPO plan as well. Last question on here, and then we're going to go off the call. Trial period for Medicare supplement to MAPD. It's a once in a lifetime trial period. When can they change? Well, if you think about it, they want to move to a Medicare Advantage plan, right? So the time to change is AEP. The birthday rule is nothing to do with trial period. Totally different. Don't get confused with the two. So this is AEP. If somebody wants to jump onto a Medicare Advantage plan using the trial period, then it has to be when you can sign up to an MAPD plan, right? Makes sense. The birthday rule is when you sign to a different Medicare supplement. That is completely different to the trial period, nothing to do with the birthday rule. Hopefully that answers those questions. I think that's about it. Anything from you, Judy, before we sign off this morning?
No, great job in reviewing all of the updates and stuff, and just everybody keep going at it. Congratulations on your uh, uh, accomplishments, and just keep up the hard work.
Absolutely, guys. We appreciate each and every one of you, everything you're doing. I know you're all working hard to try and make this your best ever AEP. There's still time. There's plenty of time, trust me. And it's all about the activity. And when we said about planning your AEP, now you can see the importance of doing that, folks. So please continue what you're doing. That was working. If it's not working, change it up. You've still got plenty of time. I know I said we'd still be less than an hour, but every time I say that, we go over time. Thank you again. Have a wonderful day. Have a wonderful weekend.